The idea of the perfect body is a tale as old as time. Think back to the Greek and Roman sculptures of chiseled gods and goddesses carved in marble, setting beauty standards no real human could live up to. Fast forward to the 21st century, and that ancient propaganda has a new stage: social media. Now it's influencers, superheroes, and the Kardashians fueling unrealistic body ideals. And plastic surgery can feel like it's just one click away from your so-called dream body. But here's the thing. There's more to plastic surgery than the glossy Instagram highlight reel. Yes, there's a dark side where it can feel superficial, extreme, or driven by ever-changing body trends. But there's also an essential life-changing side. We're talking about burn victims, breast cancer survivors, people recovering from traumatic injuries. In these moments, plastic surgery isn't about vanity. It's about restoring confidence, function, and a sense of self. Plastic surgery shouldn't be vilified. It deserves a holistic conversation as a medical tool, as an art form, and as a pathway to empowerment. And that's exactly what today's guest is bringing to the field. Joining us from Colombia is Dr. Daniela Vaca, a plastic surgeon who's rewriting the narrative around her field. She approaches her work with a holistic perspective, blending her understanding of human bodies with a vision that goes far beyond aesthetics. For Dr. Daniela, beauty isn't just about appearances. It's about empowerment, confidence, and overall well-being. Her mission is not just to transform how her patients look, but to improve their quality of life. In her practice, she's built an entire health and wellness program. Alongside her brother, Juan Sebastian, she founded Thrive Club, a program that creates personalized health and wellness plans for patients before and after surgery. We're talking about everything from meal plans to fitness regimes, designed to make sure results are not just beautiful, but strong, lasting, and sustainable. Her philosophy is clear. Plastic surgery isn't a quick fix. It's a step in a bigger journey toward physical and mental strength. She believes in enhancing natural beauty while respecting each person's unique essence, curves, and individuality. So, let's dive into the world of plastic surgery with Dr. Daniela Vaca. Hello, everybody. Welcome to another episode of #Fempire. Today, I have the brilliant Dr. Daniela Vaca calling us from Colombia. How are you, doctor?
Hi, everyone. I'm very good today, and I'm pretty excited to be here in this podcast today.
Yes, and we have a very rich discussion to come, a little bit different than the typical conversations I have. I usually interview people in politics and policy and communications, so I'm really excited to have this completely different perspective about your experience as a surgeon, diving into the plastic surgery world, and we're going to debunk some myths about it and some stigma, so really looking forward to the conversation. So the first question I want to ask you is, what inspired you to pursue a career in plastic surgery?
I studied medicine here in Colombia, and when I started to go through the different specialties, I had the opportunity to rotate with plastic surgery in the hospital that I studied medicine. And I realized that I wanted something surgical for my life. I knew that with surgery, we can really make a change in the people's life, whether it's through fixing some tissue or in orthopedic surgery, fixing some bones, etc. And then I realized that in plastic surgery, they had the opportunity to restore the function and the form and also the aesthetic of the patients. My first contact was with reconstructive patients, mostly from burn injuries. And I realized that it was really nice to see how patients, even though we couldn't approach perfection because plastic surgery is not about perfection, but we can restore some function and restore their self-confidence through these procedures. And so that was really like the first reason. And after that, I started to discover that there were a lot of things around plastic surgery. And I fall in love with breast reconstructive surgery, since, of course, breast tissue, it's really important to women's aesthetics and to women's sexual appearance and everything. And I fall in love with it. And that's why all of my practice and all of the fellowship I did and the specialties I did, it's around this because I know it's really important for women and breast cancer, but also the aesthetic part of breast. It's really important for women. So empowering women through plastic surgery for me has been really nice.
Absolutely. And I think that's one theme we're going to talk about more is this idea of empowerment. And when it comes to, unfortunately, situations with breast cancer and they have to be removed, having you step into that role and support the patient, I think is so powerful because it really is an emotional, physical stress on the body. So you being able to be part of that and starting your journey in the burn units, that's wow. Was that scary for you or were you aware of some of the situations you'd come across? Because I can imagine that might be a bit overwhelming.
Yeah, I think it's shocking at the beginning because, of course, these are people that are having like their normal lives, and one day they had a big burn in their hands or sometimes in their face. We even had contact with a woman that had chemical burns, so it is really shocking. I guess as a doctor, you have to start to develop a strong heart because you need to be there for your patients, and you, of course, you feel for them, but they need to see you strong. So yeah, it was shocking at the beginning, but with the time, of course, are very empathetic with everything, but you need to be strong by their side and help them navigate all of the emotions. In that time was with burned patients, but nowadays it's with breast reconstructive patients and also breast aesthetics and body aesthetics patients, which also has a really important part in the emotional field because you want to achieve changes in yourself because you don't like something, or you have lost some function and some form. And the decision to have a plastic surgery, sometimes it's not easy because, of course, you're going to an OR. So I think navigating emotions with the patients and being there for them, it's a really big part of my practice. And all of my collaborators here, my estheticians and my assistants are really aware of that. And we want to be with the patient so they can navigate those emotions.
And, as we're talking about your different experiences, you studied in Colombia, but you interestingly chose to do part of your residency here in Toronto. So I just wanted to know, how did that experience of working in medical facilities in Colombia compare to Toronto? And why did you choose Toronto?
For sure. So I'm gonna summarize like what I've done academic and working wise. First, I did medical school, and then I did residency here in Colombia. Residency in Colombia in plastic surgery. Colombia is one of the world's renowned place to have a plastic surgery because cosmetics have been important for Latina women, and doctors in Colombia are also very academic. So I did a residency here in a really good program in which we have exposure to the reconstructive part, but also to the aesthetic part with a lot of doctors that have a really big practice on this. Interestingly, there's a part of plastic surgery which is called microsurgery. Microsurgery does really big reconstructions that can be in the face, in the neck, in the lower or upper extremities, and also it has a really specific component in the breast. As nowadays we do a really specialized reconstruction that doesn't involve breast implants, which is nowadays an advantage, And in that reconstruction, we use the lower part of the abdomen of the woman that after pregnancies or after weight fluctuations, they have a redundancy of fat and skin in this part. And we use that with microsurgery techniques in order to reconstruct the breast with the woman's own soft tissue. And that gives us a huge advantage because you don't have to use breast implants. A lot of women with breast cancer will have to have radiotherapy to the breast, and this tissue adapts very well to radiation. And what happens with breast implants is the opposite. They become very thick and very hard with radiation, but your own tissue will behave a lot better and it won't hurt. So it's a really nice reconstructive technique. And we don't have a specific program for that in Colombia. But in other parts of the world, like Canada, like the United States, and some places in Europe, there are really well developed an academic program that offer this type of training for plastic surgeons. So I checked up the program in Toronto. I checked up another few programs in Europe, and I applied. And I was really fortunate because it is really competitive, not only among Canadians, but also people from all over the world. And I was able to get a spot over there with Dr. Stefan Hofer, which is a renowned plastic surgeon from Toronto, who specializes mostly in this type of breast reconstruction. And this is the main reason why I chose, also because I was pretty excited to live abroad in a city like Toronto, which is really nice, developed. And that was the number one reason I decided to go over there because I knew I was going to get really good training. And the difference that I saw between there and here, maybe in technology, it's a bit more developed over there because, of course, as economical resources come later to this part of the world, and maybe technology will approach places like Toronto and Toronto General Hospital first. And so that it's a really big difference. Also, I think that here in Colombia, although the access to medical care it's universal, you have to go through a really big process in order to finally get to your plastic surgeon. And I think that it's the same in Canada, but it's a bit more organized. Like cancer patient care, it's a bit more organized, so that gives the patient the opportunity to have a smooth journey. Here in Colombia, in the reconstructive part, we still struggle because there's a lot of factors. So there's the clinic, and then the hospital, and then we have something that is called una EPS, which is like an intermediary that we have to go through in order to have the authorization to do the surgery on the patient. So I think really in Canada, that's a huge advantage that everything is very centralized, and that makes everything a bit more smooth for patients coming from different social classes. I think here in Colombia, the medical system it's also very good, but I think we still need a bit more of technology involved in everything.
Wow, you covered a lot there, and it's really interesting. I didn't realize the challenges with breast reconstruction and radiation and using their abdomen fat. Like, wow. Plastic surgery feels like this really interesting mix of science and art. You're literally sculpting a person's body and image, but it's not like painting or working with clay where you can just start over if you don't like the first draft. This is someone's life and health on the line. So, how do you find that balance between giving people the look that they want and the aesthetic that they want, but also making sure it's medically safe and realistic for them?
Okay, so I think in life, nothing is perfect, and in plastic surgery, nothing is perfect. Although sometimes in social media, you see, like, oh, look, this perfect body and this perfect breast. I mean, we have to be honest and realize that plastic surgery is not about perfection, but it's about achieving natural results, having in mind every woman and every man type of body because we're different. So when someone comes, like, I want to have the breast of this model, or I want to have the body of this model, you have to sit with them and tell them, like, you, this is not about getting someone else's body because you have your own body. It is about achieving the aesthetic and the natural result you want through the help and the artistry of plastic surgery, as you said. Um, on my first days of practice, I was looking for my purpose, and there was some time that I was not really sure was it about. And then I started to work with a coach, and she helped me realize that my purpose was that trying to achieve an enhancement to help them to feel good in their own skin, but not throughout perfection, but throughout artistry, and having in mind two things, like what the patient wants, but also what the patient is willing to change to achieve those results. And this is why my brand and my practice and my purpose, it's also has developed into something beyond plastic surgery, because I think you cannot do plastic surgery if you're not willing to do some changes in yourself. And I tell them every time, like, I'm gonna be someone that helps you achieve a new self, but you need to do some changes on your own in order to achieve that new self. Changes that implies changing some habits. So I work with them a lot in the health field, in the wellness field, helping them to change their food choices. They start to see that exercise is beyond getting a fit body. It's really about getting a health body and working towards their longevity and being able to have a really nice body, but also a really nice place to live in that body, and a wellness and a health journey. So that's really important. And yeah, it is a blend because every case is very different. Every body is very different. Not one body is the same as another body, and not one woman wants the same as another woman. There are women with, for example, breasts that after their pregnancies are really heavy and are really saggy. So this woman may want a really small breast and something that it's really comfortable for them when they go to the gym, etc., etc. And there's the other spectrum of it, when the woman wants a breast that it's a bit bigger, a bit enhanced. So every woman is different. So that's why individualization and personalization is really also important in this. Sometimes in social media, you will see that patients wrote to us like, "What is the price of this?" And you said, like, well, I can give you a range between prices, but I cannot tell for sure how much is it, because it depends if we are going to use implants, if you want implants for yourself, or if we're going to use your own tissue to reconstruct your breast. So yeah, it's a lot of things. But the most important for the woman to realize is that it's a really big decision of their life, and it has to be a decision that is beyond the knife, that is also about themselves and what changes they want for their life and what they want to become better at.
Very well said. And a few things I want to kind of pick out on your points. I feel like with social media, we are always seeking this idea of perfection. We also know that women's bodies change through our lives. And unfortunately, women's bodies are also trends. And it's really important, like you said, to understand what is their goals and making sure they have a full, well-rounded plan. So we were chatting about this earlier, how you're very passionate about fitness and the wellness journey because it absolutely is a part of it. I think the misconception with plastic surgery is that it's a quick fix, that you don't like something about yourself and you just go in, do the surgery and fix it.
Yeah, so it's interesting because I've always feel passionate about the fitness field. So I also feel at the beginning a bit weird because I was like, okay, I'm doing a liposuction on someone, and this is a quick fix, and I know that quick fixes don't work. So after working around it, I realized that I had the knowledge for giving this woman both advantages. Okay, we're not going to do a quick fix. We're going to change some things on your wellness and how you're eating, how you're doing exercise, how you're feeling about yourself, how your mindset around yourself and wellness is. And then I am giving you the advantage of not giving you a quick fix, but then you know that they have to do the rest on their own with their eating and their fitness. So after working a lot on that idea and with one of my brothers, his name is Juan Sebastian. He's also very passionate around fitness. We started to develop a brand and an opportunity to blend the best of best worlds. So when a woman comes to me and says like, look, I have gained some weight because of my pregnancies or because I am a bit anxious and I'm eating a bit more. I want to do a liposuction or an abdominoplasty because my abdomen is saggy. Of course, I am going to empower her and I'm going to tell her we're doing your surgery, but I'm going to include in your surgery and a fitness and wellness program. And in this program, we're going to include what you need to eat before and after the surgery. We're going to start to incorporate some exercises before the surgery, and after the surgery, we're going to start to work a lot as soon as you can in building muscle, because if we don't do those things, we are going to lose eventually the results. You're going to reaccumulate fat. The same happens with if you get to use one of these the of GLP-1 inhibitors. The same will happen if you have a bariatric surgery. If you don't do the mindset part and put on the knowledge that you need to have in order to eat and exercise well, you're gonna lose your results and then you're gonna lose your money. And I think this is starting to take a lot of power within my community because many people have to go to other places to get that part. And here, with my brother, myself, and other team members that get everything in the same place. Sometimes I even tell women you cannot have surgery because your body weight is too high and we're gonna risk your life. So we cannot do a surgery yet. You need to lose 10, 15 pounds. And then when you get to that weight, I'm gonna do a surgery for you. And we have had women that are like, okay, I want to do this. So let's start this program. And it's really nice to empower them and to help them, of course, because there are things you cannot change through diet. If your skin is saggy, there's things you need to do surgery to fix. But then if you have the mindset part and if you have the wellness part, then you're really changing someone's life and you're changing it for longevity. You're changing it because you're going to see that these women empower themselves after that and they get a lot of high confidence. Then we'll start to see really nice things around the world because you empower them through these changes. And I'm gonna add something there. This is why I don't like the extremes of things. I think sometimes humans, I don't know why they're very extremist, like no surgery or all the plastic surgery or keto diet or nothing, or like people are very extreme with things. But I think that if you stay in the middle and you realize that you can have the surgery, but you can also do the other things for your wellness, then you're gonna do very well. The same is, for example, with women that want to have a lift in their face or Botox and all of these, I tell them like, we don't have to go to extremes. I don't have to fill your face with a huge amount of hyaluronic acid so you look weird. We can do a bit of Botox, a bit of this and that, and then you have to do the rest of your own.
Absolutely. And it's really nice to hear that full service that you offer because it is important. And I think we're seeing a push as more women are coming into the medical field and the STEM field. I feel like there is that more all round care. It's not just an in and out shop of you do the procedure, come back for your follow ups, and that's it. But having those actual intimate conversations. What is the reason you're doing this? How can I help you feel the best that you want to feel and help you get that empowerment and that confidence back? So it's really, again, refreshing to hear that that's how you lead your practice and how you work with your patients on it. So it's exciting. And on that note, as we're kind of talking about perfection and quick fixes, many people have misconceptions about plastic surgery. We touched on a little bit of them. What do you wish more people understood about your profession in plastic surgery?
So I think what I was telling right now, like you have to accept yourself. If you have a small breast, you have to live with that. If you have big breasts and that are really heavy for your back, you need to live with that. You don't like your lips? Oh, I don't know, deal with that in therapy. And I think that's like you said, it's a myth around plastic surgery. I don't think there's anything wrong if you want to do something natural to achieve and to enhance and increase something about your body that you don't want, you don't like. And of course, you have to have in mind that it's not only about plastic surgery, like, oh, my life it's not good, I am feeling sad, I am feeling anxious, so I am getting a plastic surgery. Oh my God. You're not fixing anything of that with a plastic surgery, right? But if you're working on yourself, if you're going to therapy, if you have good relationship with your family and your friends and your boyfriend or your husband, but you don't like something about yourself and you really want to work on that, why not getting that change? That won't change who you are. That won't change how you interact with the rest of the world. So I will debunk that myth about, oh, plastics, it's only about superficial people who wants to get these changes. No, I think if you do it because you want it for yourself and not for anyone else, and not for the society, but for yourself, and you have worked on your own confidence and your own empowering resources apart from the physical part, why not getting a change that you want of something of your body? Hmm? That's one thing. The other thing is that a lot of people associate plastic surgery with non-safe procedures. So of course, every surgical procedure or cosmetic procedure has its own risk, and you need to discuss with the plastic surgery you go to. But if you do things right, you go to a certified plastic surgeon, you discuss things, and you stay on the safety part of it. So, like I was saying to you, like if you do surgery in someone which is obese, the probabilities of having a complication are pretty high. So, if you work on that before getting the surgery or the procedure, you're going to lower the risk of complication, not to zero because that's impossible, but you're going to lower it very near that percentage. And so then, if you want to do a plastic surgery because your pregnancy did a lot of bad stuff to your abdomen and you have a lot of saggy skin and you cannot dress and you don't feel good about yourself, why not going to a plastic surgeon that can help you with that change? So I will say that you have to see plastic surgery through another lens, and not through the lens of perfection or something superficial, but through the lens of having a natural change that is going to empower you and it's going to help you to be where you want to be, apart from all of the other work you're doing in your life, which is therapy, which is fitness, which is eating healthy, and all of that.
Very well said, because it captures a lot of, I think, interesting areas that people don't see associated with plastic surgery and understanding those complexities, because it's not a simple quick fix and it's a long term, it's permanent results, and being okay with that and making sure it's your choice, not from these other factors influencing it. So absolutely, I hear you on that. And as we're kind of just wrapping up here, what advancements in technology or in plastic surgery techniques are you most excited about seeing coming in this field? Because we're seeing just such this rampant in AI, in changing different procedures. There's a lot more laparoscopic procedures now. So I'm just curious if there's anything you're excited about that's maybe coming up in the technology space.
So, medicine and plastic surgery are evolving every day more and more. Artificial intelligence, I think nowadays, all of the hospitals, all of the tech companies, and pharma are working towards helping the doctors use these. in order to better their diagnostic accuracy and their therapeutics. So I think that is coming also to the field of plastic surgery. We have a lot of programs when you evaluate a patient, for example. We take pictures with a camera, and sometimes you want to predict the changes that you want in order to show to the patient. So I think that technology is going to evolve on that so patients can see an approximate of the results. And also, I think that tissue engineering in the field of plastic surgery and reconstructive surgery is going to evolve every day more and more through like tissue engineering, but also through technology. For example, to people that in a traumatic injury lost their ear, or for burn patients that lost a lot of skin, so they can do more specialized and tissues that are more similar to our own skin. So I think that's evolving as well, like in all of the world, mostly, of course, in Europe, in Canada, in the States, that they have a lot of like labs that are working on these things. Specifically on aesthetics, I think a huge part of what are we seeing is that breast implants are nowadays more adaptable and more customizable. So there's a lot of companies working on breast implants that do less inflammation in our body. So a woman, when she decides to get a breast implant because of cosmetic or reconstructive reasons, all of them are going to develop a capsule. So these companies are working on implants that don't cause a lot of inflammation in the tissue, so we don't get the problems that we're seeing in some patients with breast implant illness and all of that. And I think that's important because, again, if we go to the extreme that we don't have to use breast implants, everything has to be natural. We're not having in mind that there's women that need breast implants because of reconstructive reasons, and also in the cosmetic field, as I said before, this is a procedure that will empower a lot of women to enhance the aesthetics in their breast. So I think that's really important.
Well, Daniela, this has been such a brilliant conversation. Thank you so much for sharing your insights, your philosophy, and for helping debunk some myths and stigma around plastic surgery. I've included all of Dr. Daniela Vaca's contact information and social media links in the show notes so you can check out her incredible work for yourself. And thank you so much for tuning in to another episode of #Fempire, the podcast that brings you the voices of women changing and leading in their fields around the world. I'm your host, Julia Pinella, and I'll see you next week with another inspiring guest. Catch you there.